Gum disease treatment, scaling and root planing for improved oral health. Gum disease, often referred to as periodontal diseases, is a frequent oral health condition that affects millions of people across the globe. It is caused by bacteria within the mouth produce plaque over the teeth, which may cause irritation and infections of the gums. If untreated, gum disease may lead to serious complications, including tooth loss or even heart problems. But there are many solutions to treat and possibly stop the harmful adverse effects from gum disease. The most common treatment for gum illness is scaling and root planing. The process is normally carried out by a dentist or dental hygienist. The procedure involves thorough cleansing of gums and teeth in order to get rid of tartar and bacterial buildup. It is the procedure of getting rid of plaque and tartar off the surfaces of teeth. Root planing involves smoothing out the root of the teeth, preventing bacteria from sticking to them again. The very first step to scaling and root preparation is to conduct a thorough exam of the mouth to evaluate the extent of gum condition. The procedure may include X-rays to evaluate the extent of the condition and find any bacteria-filled pockets between the gums and teeth. When the test is finished, dentists or hygiene professional will anesthetize the area with a local anesthetic. This will ensure that the patient is at ease through the process. When scaling is performed during the process, the dentist or dental hygiene professional will make use of special tools to get rid of plaque and tartar from your teeth. It is generally done between the gum line and above it to make sure that the teeth are thoroughly cleaned. In certain instances, it is possible to use an ultrasonic scaling device. Be utilized to break up plaque and tartar to allow in order to facilitate the removal. When the teeth are taken care of, the next stage is root planing. Root planing involves smoothing the root of teeth in order to keep bacteria from sticking. The procedure is carried out using specially designed tools that fit between the gums and the teeth to get rid of any bumps or blemishes. This procedure can be more time-consuming than scaling because it involves a more thorough procedure to ensure that the root are clear and smooth. When the scaling and root planing is complete after the procedure is completed, your dentist or dental hygienist might schedule follow-up appointments in order to track the results of treatment. It is crucial to follow excellent oral hygiene habits at home, including regular flossing and brushing so that gum disease is prevented from coming back. In certain instances, dentists may advise the use of antimicrobial mouthwash in order to eliminate bacteria and avoid the spread of infection. All in all, root planing can be a beneficial treatment option to treat gum disease. It will assist in enhancing dental health and reduce the risk of issues. In removing plaque and tartar off the teeth and smoothing the root and gums, patients may experience less inflammation as well as improved health of their gums. If you believe you suffer from gum disease, it's crucial to consult the dentist for a thorough examination as well as to talk about treatment options including scaling and root planing. Keep in mind that timely detection and treatment are essential to prevent the development of gum disease and keeping the health of your smile.